Okay, ladies and gentlemen, good afternoon and welcome to the Health and Wellbeing Overview and Scrutiny Committee meeting. Just one or two bits of administration to go through first. Apologies for absence.
Received from Councillors Foster and Nisbet.
Thank you very much. Disclosure of members' interests. This is the time when members have the opportunity to declare any personal interest they may have in any items on the agenda, which they haven't already declared in the past on the forms that they have in the County Council. Has any member any disclosure they wish to make at this moment? I take that as a no. Thank you very much indeed. Just before we go on to the report, I would like to read something out to everyone so we can all fully understand exactly what we're here to do today. Members will recall that the basis for the referral to the Secretary of State was that Northumberland Overview and Scrutiny Committee was not satisfied with the adequacy of content of the consultation with the committee and the time allowed. We also considered that the proposal would not be in the best interests of health service in the area. The Independent Reconfiguration Panel accepted the referral and reported to the Secretary of State, who accepted the IRP recommendations. The letter from the Secretary of State and the report of the IRP were received by email on the 14th of November 2018. The actual hard copy letter didn't come till the 17th of November. Members have copies of both. There was no instruction in the report to rerun the consultation or to reopen the beds, but further action was required locally to agree and implement the Health and Wellbeing Centre. Inpatient beds were to be considered as part of that work and the wider development of services at the hospital and in the local community. In order to address these recommendations, a Health and Wellbeing Overview and Scrutiny Committee for Rothbury Hospital review group was established. Membership of the group was sought from the Health and Wellbeing Overview and Scrutiny Committee. The cross-party membership comprises Councillors Cessford, Dungworth, Moore, Rickaby and Watson, together with a representative from Healthwatch Northumberland to be involved throughout the process as an independent voice. Councillors Watson and Rickaby were appointed chair and vice chair, respectively. As with any scrutiny group, the group met in private on the 4th of December to scope out the work by considering the letter from the Secretary of State and the IRP report and agreeing areas requiring further evidence of investigation. Members agreed the term of reference as follows: to consider the findings of the Independent Reconfiguration Panel as accepted by the Secretary of State and work with Healthwatch to challenge parties in order to reach a balanced response and provide an update to the Secretary of State by the end of January 2019 as requested. Noting that work will be going on after that, which the Overview and Scrutiny Committee will need to monitor and review. Just pause a second, we'll give these people a chance to sit down. Continuing on, the review group would test and give a view on the proposals and evidence put forward, but it is not in their remit to determine the outcome. The review group agreed a list of questions covering the areas requiring evidence and investigation, copies of which were circulated to the members of the public and press present at a second meeting of the group held in public on the 10th of December. The purpose of that meeting was to formally present the questions to the CCG and Trust representatives who were asked to provide a response by the 11th of January 2019. A meeting of the review group was then held in private on the 16th of January to allow members to focus on those responses and decide whether there were any further areas to review or any further information was required in order to report back to the Health and Wellbeing Overview and Scrutiny Committee meeting on the 23rd of January today, prior to responding to the Secretary of State by the end of January. The minutes of all 3 meetings of the group have been circulated and are in the public domain. Following the meeting on the 16th of December, copies of the responses to the questions provided by the CCG and Trust were circulated to the Scrutiny Committee, Councillor Stephen Bridget, the local member, and Katie Scott, coordinator of the Save Rothbury Hospital campaign group. An opportunity was offered to Councillor Bridget and a representative of the campaign group to address the Overview and Scrutiny Committee today. This meeting is to be conducted in public, but it is not a public meeting. Members of the audience are asked to respect this. We will, however, receive an address by the local member, Councillor Stephen Bridget, and Katie Scott, coordinator of the Save Rothbury Hospital campaign group, on the responses of the CCG and Trust to the questions set. Before we start, I will explain the running order of the meeting. Presentation and addresses up to 10 minutes from Katie Scott, coordinator of the Save Rothbury Hospital campaign group, will be our first speaker, followed by Councillor Stephen Bridget, who again will speak for up to 10 minutes on the subject that we are here to consider. We'll then have a feedback from Healthwatch Northumberland. We'll then have a presentation from the Northumberland Clinical Commissioning Group. We will have questions from the members at any time to the CCG and Trust and to Councillors Bridget or Katie Scott at the end of their presentations. Committee members then will discuss and consider the evidence presented to them. Following the reports from the review group and the discussion at this meeting, the committee needs to agree a way forward on 3 issues. How it wants to be involved in the development of plans for the Health and Wellbeing Centre in Rothbury, what more the CCG needs to do in response to the independent reconfiguration panel's criticism on their inpatient beds.
Call for the speakers now, Chairman.
Sorry?
Call for the speakers now and get the meeting.
Will that read any more?
No.
Okay. So I'll read the last one. The update which the Secretary of State has asked for by the end of this month. Okay, so we'll move on then to the programme and ask Katie Scott, please, to do the first presentation.
Hello, thank you. On behalf of the Save Rothbury Community Hospital campaign and the people of Coquetdale who have asked us to speak on their behalf, I am grateful for the opportunity of being allowed to address the committee this afternoon. Before I begin, may I draw attention to a very timely piece of independent research which was just published yesterday by Birmingham University. One of the authors, John Glasby, Professor of Health and Social Care, concluded that, quote, community hospitals represent a significant community asset with a strong sense of community ownership. Their provision of local, accessible health and social care services has important practical and symbolic significance, particularly in isolated communities. Policymakers need to take into account a broader notion of value, focusing equally the value to the patients and the community as on the money. I hope that the NHS and CCG will take time to read this report and try to think about our community as much as about money. And as for our response today, we have only recently received some documents from the CCG which they have produced in response to the Council's wide-ranging questions. These will take a little time to analyse, and the campaign is not, therefore, in a position to comment on them today. Also, I heard yesterday afternoon from the CCG that they are going to be presenting more data and more information today which we have had no sight of. Clearly, it would be pointless to comment before hearing and seeing what they are going to say. Besides the issue of the new information, the 10 minutes allowed today to address all of the issues relating to and arising from the continued suspension of the use of all of the beds at Rothbury Hospital is clearly nowhere near enough time. Moreover, we want you to know that we and those we represent are really disappointed in how we feel we have been treated. We believe that in the interest of natural justice, it is only right that we, the campaign team, has the same access to the information as the committee does. Our desire is to help and support the committee. We want the best outcome for ourselves, for our loved ones, for our friends and for our neighbours throughout Coquetdale. We are certain that we need the beds to be reinstated. And we can show you why we believe this so strongly. Let's talk about engagement. In a letter on the 12th of November 2018, sent to the chair of this committee and to the CCG, the Secretary of State for Health and Social Care required of this committee, and I quote, to engage fully with the community. He also ordered that the committee and local stakeholders, including Healthwatch, and I again quote, should be involved in the evaluation leading to CCG consideration of the case for whether or not to reopen the beds. The CCG has already accepted that both the campaign and Healthwatch are local stakeholders. We respectfully suggest that to address this committee for a maximum of 10 minutes cannot be described as engaging fully and cannot be described as being involved in the evaluation. We are anxious and very willing to talk in detail to the full membership of the Scrutiny Committee so that you may obtain a thorough and accurate understanding of the views of the campaign. Our views are based on factual evidence. We should also note that the Minister's requirement is for the full committee, not just some members of it, to engage with the community of Coquetdale. May I offer you an invitation? I would like to ask you, Chair, if you would please permit our campaign team to make a detailed, informal presentation to this committee at a mutually convenient date. I ask also that this presentation would take place in Rothbury to enable members to view the very fine facilities at our hospital. We guarantee that the presentation would be made in a respectful and courteous way by 2 or 3 members of our campaign team, and we suggest that this would be without members of the public or officer attendance. We would like to share with you the wealth of factual information we have collated. The campaign team has already been invited to discuss these issues directly and separately with the CCG, and of course we have agreed to do so. We very much hope that you, Chair, and your full committee will accept our suggestion of attending a presentation by us, and that you will agree that this would be a helpful and constructive way forward. We are sure that all members of the Scrutiny Committee want the best outcomes for the people of North Northumberland, and also that you want to ensure the process for achieving this is fair, transparent, and honest. Thank you.
Anyone, any questions they'd like to put to Katie about what you just said?
Well, no, I was just going to wait till the speaker's spoken first.
Okay. In that case, Councillor Bridget, you have 10 minutes now.
Members, before I begin, I'd just like to point out that in future, if an exercise like this is to be carried out, where the local member is asked to speak, it would be beneficial if the same invitation was also extended to Councillors Riddle, Sanderson, Thorne and Patterson, whose areas also cover parts of the catchment area for Rothbury Community Hospital. Because whilst it is in my division, the actual location, their residents also benefit from the provision and have benefited from the provision of those beds in the past. Members, I thank you for allowing me to speak here today to offer my responses to the information provided by the CCG last week, which now appears to be out of date, given the new information that appeared on the Council website just after 9 o'clock this morning. First of all, I want to speak on the process that has allowed us to arrive at the position we find ourselves in today. In his letter to the chairman of this committee, dated the 12th of November 2018, the Secretary of State wrote, and I quote, "The Health Overview Scrutiny Committee and local stakeholders, including Healthwatch, should be involved in the evaluation leading to the CCG consideration of the case for whether or not to reopen the beds." Now, any ordinary Joe Bloggs would interpret that as meaning local stakeholders, but not limited to Healthwatch Northumberland. Not Northumberland County Council. They chose, despite the written advice of the Secretary of State, to only select Healthwatch Northumberland to sit on the working group as part of the evaluation leading to the consideration of the CCG case. A person or persons within Northumberland County Council took the decision to directly ignore the advice offered by the Secretary of State and only select Healthwatch to be part of this review group. The reason I know this is what happened is because following a Freedom of Information request, I determined that it was an officer of the council who drafted the terms of reference for this review group that only included Healthwatch as the local stakeholder, and that officer was following instructions from someone. If this is not the case, could someone please provide me with the correct information regarding this matter, as all information revealed by an FOI request either states or indicates this to be the case. I'm sure that you will have all read the report from the Independent Reconfiguration Panel, where it highlights the failings by both the CCG and Northumbria Healthcare Trust in how they consulted and in some cases failed to consult local residents during this entire process. It had been my hope that when this matter was referred back to this council, that we, Northumberland County Council, could set the bar and the standard and really show the CCG and Northumbria Healthcare Trust how consultation and engagement should be carried out. Unfortunately, my own authority has thus far failed, just as the CCG and Healthcare Trust did. We had an opportunity to engage with local stakeholders who truly represent the people of Coquetdale, their elected representative, and the hospital campaign group. This council chose neither. As a result, both I and the campaign group have been excluded from attending these private meetings or these private working groups, but the CCG and Northumbria Healthcare Trust have been allowed. We had no idea what was being discussed, particularly at last week's meeting. That was until the notes of the working group and a whole raft of new data from the CCG appeared on the council website this morning, giving us ample time to prepare for today's meeting at 1 p.m. I am shocked at the way this exercise is being carried out, and I'm not frightened to say it, that in my opinion, the bias that is clearly visible to both me and my residents that is being shown towards the CCG and Northumbria Healthcare Trust is absolutely shocking. This committee today can take the first step to rectify that problem and let my residents see that they are actually being represented in this process. Any one of you sat here can propose that myself and a representative from the campaign group could be co-opted onto the review group. There is nothing in the council's legal structure that prevents it, and it is entirely at this committee's discretion. It is not within my remit to instruct this committee what to do. I can only ask that you adhere to what the Secretary of State the Secretary of State's advice and allow my residents to be represented by their chosen stakeholders. I now want to move on to the CCG's responses and the data that they have provided regarding the future of the site. The CCG and the Trust state in their response to you, and I quote, "However, during the intervening period, the GP practice, previously located in Rothbury, relocated to the ground floor of the hospital site. This move has enabled the co-location of a number of services which support the Rothbury community, including community nurses, physiotherapists, podiatry, and the community paramedic." Let me give you some clarity on that response. Clarity which both organisations appear incapable of giving. The community nurses, the physiotherapists, the podiatry, and the community paramedic were already based at the hospital long before the closure of the beds was implemented. The doctor's surgery moved up to the hospital just over a year ago, but I have been aware for at least the last 5 years that the intention for the doctors to move into the hospital has been a long-standing proposal for a number of reasons, not least the expiration of their lease on half of the building they occupied in the centre of Rothbury. So let's be clear. If the CCG or the Trust is attempting to report that they have developed anything new or different at Rothbury Community Hospital other than closing the beds, they haven't. With regards to the community teams, I'm going to offer a bit of advice. If you get the chance, outside of this meeting, and without their senior managers standing over them, ask those community teams what they really think of the new approach to community care and just how understaffed and overstretched they really are. The fact that the CCG and the NHS Trust are referring to any data from the Walton unit in their responses or information given today is just ridiculous. They closed the Walton unit. Sorry, they've moved it to Wandsbeck. With regards to question 5 and why the Overview Scrutiny Committee were not originally consulted on the proposed temporary closure, the IRP report states quite categorically, if the permanent closure was indeed held by the CCG to be a substantial variation, logic suggests that the temporary suspension of inpatient admission that preceded it in September 2016 should similarly have been considered as substantial, and the Health, Wellbeing Overview Scrutiny Committee informed in advance of this proposed action. The simple fact of the matter is this: the CCG and the NHS Trust failed to properly consult the relevant parties, regardless of what they state in response to question 5. This committee may well arrive at the same conclusions as the CCG and the Trust. I sincerely hope that is not the case, but what would have been even worse is for this committee to arrive at those conclusions based on evidence from the CCG and Northumbria Healthcare Trust that was fundamentally flawed and from a failure to properly and adequately consult the residents affected. That is the failure of the CCG. It cannot be a failure of this committee. On one final note, as you all know, my area has a significant ageing population, extremely poor transport links, especially as you progress westward into the Upper Coquet Valley. I would urge this committee to consider holding some or all of its future meetings regarding Rothbury Hospital in the communities that are most affected by the closure of these beds. That way, many of my residents, particularly those who are of a more senior age, can engage with this process and consider holding them in an evening when the majority of the population who work can actually attend. The chair of this committee made a statement to me in correspondence dated the 8th of December. With regard to holding a meeting in Rothbury, again, it is the intention of this group to do so, but once fundamental arrangements are agreed and the CCG and Trust are able to provide evidence and information required to allow a full discussion. I hope that this committee, or at very least the working group, will allow this to take place locally. Thank you for your time.
Thank you, Councillor Bridget. Questions from the floor? I'd like to just clarify one point before we go any further. You were saying that the remit for consideration was prepared by an officer. How was that done? It's quite simple, really. It was discussed and agreed by the committee that those were the subjects that should be looked at, and certainly not by one individual, as you were intimating. The committee discussed it and agreed with the recommendations or put forward by the officer. Anyone else like to make any? Yeah. I would let you. I don't have to, but yes, to go in this case, I will.
Well, no. The information that was provided to me by the Freedom of Information team clearly states a set of terms of reference that were drafted by an officer and then approved by that working group. That is the point I was making. They were actually written by an officer, and then the working group approved them.
Yeah, of
there
course.
wasn't any discussion or recommendation deviating away. There's certainly no notes to confirm that,
No, but
or minutes.
when any time an officer writes,
being allowed on that committee.
any time an officer brings things to a committee, as you well know, it's at the request of the committee to do so. The committee made a request, the officer brought them forward, they were approved by the committee. End of story. I don't think we should pursue that any further. Right.
Any other questions? Chair?
Any other questions?
Just a note about Healthwatch there.
Okay.
Chair, do you mind if I just Chair, do you mind if I just get in my head crystal clear what this committee is doing today and has been doing throughout the process? And it's my understanding that we are here, that we were previously considering evidence put forward to us over the last couple of years, over the last year or so, when it came to this committee, when we decided to refer it to the Secretary of State. And our role at that point was to scrutinise the consultation process that the Clinical Commissioning Group had undertaken, and to scrutinise the process that Northumbria Healthcare Trust had undertaken, and therefore the decision that they had reached at that point. And at that point, we decided as a committee that the consultation process at that point was flawed, and we referred it to the Secretary of State, of which the Secretary of State has agreed with this committee in that the consultation process that had been undertaken up to that point was flawed. Therefore, now going forward, it's my understanding that we need to, as a committee, make sure that we get the best process delivered going forward by, again, understanding from the Clinical Commissioning Group and the Northumbria Healthcare Trust what additional measures they have taken since receiving that correspondence going forward that will reassure us enough to provide a sufficient enough detailed response to the Secretary of State. And today is part of that process. So I suppose I'm sitting here taking on board completely the comments that the local member has made and Katie Scott has made, and it will be interesting to hear what the Clinical Commissioning Group are going to now say, and we will have the opportunity to scrutinise them again as part of the process. So I know it's not a question, but it's just getting things absolutely crystal clear in my mind what my process point is.
My understanding exactly the same.
Yes, Chairman.
And the lawyer is on our right here is saying exactly the same as well. So I think you have encapsulated very well, Robbie. A comment that I would make about the question about Healthwatch. Healthwatch in their remit is to act as an independent voice for the local community. And that is why they were added to the membership. Healthwatch could consult and feedback from residents and individuals and anyone else who is part of the SRCH or not part of the SRCH. And that was the job that we believe that Healthwatch could do, and I think we believe that's what the Secretary of State was asking us to do. Thank you very much. Right. Presentation from the Healthwatch.
Good afternoon, everyone. I'm Debbie Nugent. I'm the project coordinator of Healthwatch Northumberland. You've just heard the role that was set out for Healthwatch Northumberland with regard to collating feedback about the Rothbury Hospital proposals for the review group. And you've also heard about the role of Healthwatch Northumberland, but I thought it might be worth just reiterating that briefly before I go into what we have managed to collate. Healthwatch is the independent champion for people who use health and social care services. So that is basically all of us. Our sole purpose is to understand the needs, experiences and concerns of people who use those services, and to ensure that those experiences and views are heard by those in authority, and that those authorities provide a proper, reasoned and transparent response to the issues raised. Healthwatch is not a decision maker, nor is it a campaign group. What we will do, and what we have done in this process, is to continue to make the case, based on the evidence of the experience of people using services, for effective public involvement in decision making about those services to get the services right for the future. So moving on to the collation of that feedback, I would give my thanks to everyone in this room who has fed back to us, and also to Councillor Bridget and to Katie for enabling enabling that process. During its involvement with the Rothbury Hospital Review Group, Healthwatch collated the views of people in the Rothbury and Coquetdale area, and I think it's important that we continue to stress that. Between the 10th of December and the 21st of January, 18 emails were received, and for members of the public in the Coquetdale area, and 2 from 2 local WI branches. We met with representatives of parish councils in the Upper Valley and with the Save the Rothbury Hospital campaign. However, the feedback we have collated is from a longer and wider perspective, covering the initial consultation period, focused engagement about GP and dental services in the area, and work with carers in the Coquetdale Valley, in the Coquet Valley, about home care services, and also now some research of our own about transport. While this debate has come to focus entirely on the issues of inpatient beds, a potent symbol of a changing service, we feel the wider perspective of the health and social care system is the important perspective, because if it is to be successful, it has to be successful in all elements in the system. So what is the feedback? All contacts we received stressed the role of the Save Rothbury Hospital campaign in reflecting the feelings of the people they had been in contact with, and were in favour of keeping an inpatient facility at the Rothbury Hospital. That was supplemented by a feeling that the decision-making process was not responsive to the views expressed. So that, in essence, is the summary of the feedback we received. However, 3 main themes emerge from the feedback. Firstly, effective public involvement in decision-making. 2, the future of the service provision in the area. And 3, access to services. With regard to effective public involvement, from the initial consultation onwards, concerns were expressed to us about effective public involvement in decision-making. This was expressed as negative feelings such as anger and dismay. Where Healthwatch spoke to people over the last 18 months about different services, it remained a key issue that public concerns articulated by the hospital campaign and others were not being taken into account. Whatever issue was under discussion came back to essentially, look what happened to the hospital. The tone of debate has been noted as an area for improvement in the letter from the Independent Reconfiguration Panel, and the feedback we received said that because of the length of time that has elapsed and the perception of decision already being made, finding common ground would be difficult and would require the CCG and Northumbria Trust to do at least 3 things. Firstly, demonstrate listening. Local feelings have been articulated through the campaign and others, and continue to be put forward. And it was important to show that these concerns had been addressed in the proposals for the hospital, and also if and how things have changed as a result of that feedback. They were also asked about early and meaningful communication. Many people who got back to us said there would be an appetite for discussion about the development of a health and wellbeing centre, notwithstanding the decision over the inpatient beds. But there must be a meaningful discussion at the earliest point of the commissioning process. Focus groups, more and regular communication and gathering of ideas during the process were mentioned as examples of what would be required. There was also people asked us to put forward also, and the feedback was about recognition of the role of the wider community. There was a view that many people are supported to live in the community with illnesses through the help of neighbours and friends, and increasing the need to travel for treatment or visiting has an impact beyond the patient. This needs to be recognised and supported as part of the overall system of support. Moving to future services, linked to this feeling of not being involved, people said that they were worried, concerned and sad, expressing uncertainty about the future and a sense of loss of something of value to them in the proposals. The feedback we got was that people still do not understand fully the rationale for closure of the inpatient beds. One group described a degree of cynicism about the rationale for closing the beds linked to reported belief that patients had been diverted from Rothbury Cottage Hospital. This was a recurring theme and expressed much more strongly in many cases and highlighting a lack of trust in what had happened. Over 20 examples were shared with us of patient and or patient carer experiences related to the use of inpatient beds at Rothbury or with people receiving care outside of the area, including in Newcastle. While we recognise and accept there are many factors affecting all of these decisions, not least clinical ones, there remains an overwhelming belief from the feedback that we've received that the overall impact of the inpatient beds, the patient experience, is not being taken seriously or considered in enough detail. A better explanation of the historic and current data and experiences with real opportunity to discuss would be required to start to address and rebuild relationships with the community, we would suggest. There was support for a Health and Wellbeing Centre as part of the web of social care, health and social care services, but more detail was wanted about how this would work in practice before there was confidence in it. Some people again said there was an appetite for being involved in developing this service, but this was always tempered by a lack of confidence that their views would be listened to and could be seen to have affected the results. Healthwatch also reviewed the feedback gained as part of a project we have working with a group of carers in the Coquetdale area. While this work was focused on the operation of home care services, it highlighted ongoing concerns about the service overall, which forms an integral part of the proposed system to replace the inpatient beds. Again, coming back to the point that if it's to work, all parts of the system need to work. There continues to be a feeling that the current proposals assume best case scenarios, but what if someone is not the perfect patient, someone said to us. Accessing services. Being able to access services from Rothbury and the Coquet Valley was seen as an issue of fairness and equity for people, with particular concern for those on fixed incomes who do not drive and where distances and weather can affect the ability of providers to maintain a service. There are differences in patient and outpatient services undoubtedly, but the logistics and impact on people's lives and day-to-day experiences by things like travel alone cannot be underestimated, we were told. We have looked at the practicalities of transport related to the main hospital areas, Alnwick, Wansbeck, Cramlington and Newcastle, and we will be publishing a paper shortly on this issue. What it will highlight is the well-known problems with public transport, and it's clear, but what it really does emphasise is that there are a number of uncertainties around public transport due to changes in funding regimes, and that any of those could therefore impact on the health and social, the patient experience of health and social care services. I think one of the things that we would say when we looked at the transport and equality impact assessments, that this was an area that really does need to be looked at again in further detail. The Department of Transport in their National Transport Survey produced statistics that show the percentages of each age group with a driving licence. And if you go back and look at those figures and then look at how that maps out across age ranges and what we know about the age spread in in Coquetdale, you can see that actually some of the assumptions about who drives and how long they will be driving and the impact that will have on their ability to use services and access services becomes very real. In short, we say evidence points to the importance both now and in the future at looking at those issues of accessibility in much more detail. In summary, the feedback we have received reflects the views expressed to Healthwatch Northumberland over an extended period. The strongest and most consistent view expressed is for the views and experiences of people in Coquetdale to be listened to. Healthwatch has raised this issue at the review group and with the Save the Rothbury Hospital campaign and with decision makers. It is a clear message from the independent review panel that relationships need to be improved, and addressing the issues we have set out, we believe, would start to rebuild those relationships in a constructive way. Our view in discussing this work with decision-making authorities is that this issue needs to be addressed. We argue that all shades of opinion in the Coquetdale communities needs to be gathered in the design of their local services. And we say this knowing that there will be that any changes to the way that services are delivered might not find favour with everyone in the community. Thank you.
Jerry, before you leave, we might have questions. Have we got any questions from the floor? One from Councillor at the end.
Hi, Derry. Thanks you very much. Obviously, we've met quite a few times, and I praise the work that Healthwatch does, and I noticed that the Independent Reconfiguration Panel does that as well. Praises the work that you do, and bringing forward the responses from the community to us is a very good aid. I don't think there's any argument from the outset that there's been issues, which is why this was referred in the first place. It's how that they react, as indeed Councillor Moore said before, since it was referred back. What is the Healthwatch's opinion of CCG's role in this in the initial stages? Is it the does Healthwatch have any opinion as to the lack of proper due process that went on initially?
Our view is always based on the evidence that we get and the feedback that we get. So as I tried to set out in what I've just said, the feedback that we've had, not just in the last 6 weeks, but over the period, and I think if you look back to our contribution to the initial consultation, we were reporting the same issues. And I think what was very clear then and what is very clear now is that there are two aspects to being listened to. There's the saying and then there's the receiving. And I think what's very clear from the responses that we've had over that entire period is that what people are now looking for is how what people are saying affects the decisions and the proposals going forward.
I've got a question for you. You've said you are looking at the transportation issues. When we talk about transportation, are we talking about visitors to the hospital rather than patients being admitted? Because presumably when patients are admitted to hospital, there is ambulances or cars to take them there.
Yeah.
So we're talking about visitors' accessibility to hospitals.
Yeah, if I could sum up the issue, and what I would say is that this is an issue that is not, obviously, as we all know, sitting here in Northumberland, this is not just an issue about Rothbury, this is an issue that we address as Healthwatch across the county. But with what I would say is with any issue like this, you're looking at two aspects, aren't you? You're looking at either how, in any community, services can be brought to it, or people can travel to services. And when you start to look at travelling to services, then obviously, yes, you're right, if people are being taken by ambulance, then that's not the issue. But it is about what is the transport infrastructure and how secure is that for people who need to get to appointments, but also who need to visit and support relatives of loved ones in those services as well. And I know that I know you could say that, well, carers aren't the patient, but they are part of the system. They are part of the health and social care system.
Yes, with a question.
Oh, okay.
Then you.
Questions, then you.
Thank you. Really, this follows on for Councillor Sesford's comments about your opinion of the consultation process. Obviously, you have indicated that up to now there have been flaws, and that has been brought forward by the Secretary of State, etc. I suppose my question on having said that that the residents want them to listen more and communicate more. And it's difficult for me to ask this because we haven't heard from the CCG and NHS, but have you seen an improvement in the response from the CCG and NHS to the needs of the people of Coquetdale who will be going to Rothbury Hospital?
As I say, until we actually see the detail of what the presentation is, it's difficult to answer that. But I suppose what I would reflect upon is that I have said the same things, and Healthwatch has said the same things to the CCG and to the Trust as we have said to the campaign, that this will only work if people are willing to engage with each other. And certainly I would say that going on other experiences, then I think there's an intention to engage, but it's just we need to then see how that goes forward.
I appreciate that. Thank you.
Thanks. My question's following on from the same question as well, and I don't know if I'm going to word it right, but there is always an issue with consultation that it's very difficult, I think, for people to feel that they're listened to. And I suppose I wanted to tease out a bit more in terms of what people are expecting from that. So to be listened to doesn't always mean that you get what you want. No. But it is, so and I know you're not saying that, so I just really wanted to understand a bit more about how that could be translated.
I think obviously I'll refer you back to my last statement, saying that any changes are not going to find universal favour. That is the nature of life. But what I would say is that in any consultation process, to be viewed as successful, that at least people feel that they've had their say, that they've been listened to seriously, that their concerns haven't been dismissed, and that even though they may not get absolutely everything, that they can see where they've had an influence. And I think that is the big test, that in any consultation you can at some point say that's where it's had an effect. And that's certainly what we'd say.
I'd like to come back with another question. You're talking about the Health and Wellbeing Centre and more detail required. I think that's something that we have also asked for, and hopefully we'll get that today. Have you had suggestions from your contact with people about what they would like to see in the centre, and have they actually been passed on to the CCG?
Yes, as part of the initial consultation, I think if you look back at the response, you'll see that there was a table within the response which gave an idea about some of the services that people thought might be applicable to the Health and Wellbeing Centre. And yes, I mean, in our feedback, people have mentioned some of the services, but taking Councillor Bridget's point, it's about what services are brought together as a whole. I mean, so there have been suggestions which go across the spectrum, not just health services, that go across the spectrum of services.
Thank you. Any further questions? If not, thank you very much, Terry.
Thank you.
And I think we have CCG next.
Hello everybody, good afternoon. My name is Rachel Mitchison. I am a Senior Commissioning Manager for Northumberland CCG, but I present to you today on behalf of both the Trust and the CCG a number of slides. So the purpose of this presentation is obviously to provide the responses to the questions that were given to us by OSC. We will show you some of the data that has been talked about, a bit of an update on where we are with the engagement process, and a look at the current and the proposed options for the community offer. This is all to help with the response to the Secretary of State's letter, and we'll also provide an update on the governance and the timeline and what we're required to do for the next steps. It is very much a point in time on a journey that we're going on, and I'd like you to bear that in mind. So the first question was around the future of the site, what the content of the Wellbeing Centre is, and a review of the inpatient beds. So just from a point of view of a bit of a summary, the first floor of the building has remained unchanged. The Trust and the CCG have not been in a position to do anything further with that while awaiting the outcome of the IRP letter, so that has remained the same. The GP practice has now moved into the ground floor of that building, which obviously was planned to do, and that has enabled the co-location with the services that are already part of the outpatient service like physiotherapy, as well as the community services, community nurses, and there is now a new palliative care nurse in that team as well. The Trust have continued to do a lot of work around using technology with regard to virtual clinics for outpatient work. That has been quite proven to be popular and successful with patients and has been reviewed very positively. The CCG and the Trust have also done a lot of work on length of stay, which is part of a national direction, to look at improving flow of patients through hospital, looking at why people might be in hospital longer than they needed to be, and looking at whether some of those assessments can be done in the community to speed up the discharge process. We have also looked in the community at the development actually within the whole of the North locality, of which Rothbury is part, about a new community focus on being a bit more proactive from the community nursing perspective, focusing on the multidisciplinary team and making sure that there is a team approach and a proactive way to try and keep people at home and be a bit more planned and enabling people to have a plan should they need it going forward. So just to provide a little bit more detail from that, now that the GP practice is in that building, last week there were 430 patients that actually went into that building to see their GP. I spoke to the practice manager and to the GPs there, and they do have a weekly MDT meeting, which, because they have got better facilities, slightly bigger rooms, they're able to include a wider members of the team into those discussions, like social care, as well as the voluntary sector, and Age UK also attend there. They've got a very new, innovative post in a nurse practitioner with a specific focus on frailty, which is a really positive contribution. They've run things like coffee mornings for Macmillan, where actually they raised over £800, and it was so successful they want to do that on an annual basis. They, for the first time, were able to do a Saturday morning flu clinic, which they felt was a real change because they had more space there and they managed to vaccinate 600 people in that time, whereas I think before they'd had people queuing down the street. So the new facilities for primary care are much better. They feel that now the integration with the other services, the community nurses, physios, is opening the door for new ways of working that they hadn't been able to consider before, because they see those professionals more, and it actually is looking at then more different workforce options which they feel will blossom in the future. They said the parking is much improved and is free, and that's been really positively reviewed by the patients. Last year they held an open day as well, so that they could engage more with the community, be more proactive about the services that they offer, and carried on doing like blood pressure checks within the service. So I think the fact that the GPs are there has breathed some real new life into this building. From a point of, so I've mentioned about the co-location of those services.
Excuse me, can I just ask the audience please to refrain? This is not helping. If we let the person speak, please. Thank you.
Thank you. The outpatient clinics and appointments have remained unaltered. It's just a reminder there of the services that are available: physiotherapy, health visiting, dietetics, Talking Matters Northumberland counselling services are all also ongoing in that building. So that's really what's currently available. From a point of view of what we can further explore in developing, obviously I've mentioned around the use of technology and virtual outpatient appointments. Rheumatology and looking at sort of more blood monitoring on a regular basis is being looked at. Role of health trainer sessions, looking at smoking cessation, nutrition, hydration, slips, trips and falls, either sort of individually or within groups. Dental services is something that we were thinking about as another option to explore, and maybe it's more mental health services around the emotional health and well-being, again either groups as well as to cover things like dementia. Those are the sort of things within the NHS family, but we also want to look sort of outside that and look wider. Public Health have recently recruited 5 locality coordinator posts. One is dedicated to the north. This is around looking at this sort of community asset and making sure that we've got a good understanding of all the services, whether they're luncheon groups, other voluntary sector organisations and groups, to pull that together to make sure that we've got a really good understanding of that. They're new posts, and I think that's really a positive new look at what's out there in all the communities. The CCG would also like to fund a development post with a focus on how we can coordinate this new offer and have some dedicated time to developing this, pulling on the information that the new public health post might bring, as well as all the other things. We want to explore best practice, what else is happening out there in other parts of the country. There's a few examples there, some were mentioned in the letter, some that we've looked at, because we think it's important to see where this might be working well in other areas. From a point of view of our past engagement and consultation, this is a summary of all the activity that was carried out in the past. So there was 3 sort of drop-in sessions, before the consultation, and then within the consultation there was some public meetings, 4 drop-in sessions. We used I mustn't it right in here, it's very small, I apologise. So there was dedicated page on our website. We had an independent online survey. There was a YouTube video clip. We used social media, and obviously Healthwatch also carried out some of the sessions. With regard to our engagement and how we want to engage going forward, this is our sort of current thinking and proposal. So we do very much want to work with the list of people there, the campaign group, Healthwatch, local parish councillors, the patient participation groups and other interested people and groups. But we want to do that in a small group way where we can actually sit and talk and discuss the information that we've got, because it is better to do it on that small group level, and that's what we would like to do in the next coming weeks and months. Although we haven't totally firmed up what those groups will do, it's anticipated that we would maybe look at visiting other local services that we've got. We're aware that there are other places in Northumberland that we could go and visit. We want an opportunity to look at the data. I'm going to go through some of that data, but actually the data as a picture is hard to understand, and we need to discuss it. How do we understand it? How do we each interpret it? And what does it mean? And come to that conclusion together. And we want to explore those other national options and best practice and see what else is available. We're aware that there are a number of other professionals and we want to look at and engage with them and how they may work differently and in a sort of integrated way. And then the outcome of all of that ultimately would then feed back into the committees by the Trust and the CCG. So we have re-looked at the data and refreshed it and brought it up to date from the last time that we looked at this. What we would very much like to do is make sure all our data is independently looked at by an independent organisation, and we will look to do that. The data that I'm going to show you covers what's available in the community, the hospital and in social care. And it will absolutely need to form part of the engagement work that I've just described. It is very difficult with the data because it can be interpreted differently, and I'm very, very aware of that. So the first one is looking at the bed occupancy of Alnwick Infirmary and the Walton unit. So we've got Alnwick in blue and Walton in green. And this is occupancy. It's the mean occupancy at midnight, which is how the Trust record their data. So basically, at midnight, they count who's in their beds, because obviously within a day, they could have had more than one person in. So it's the number of people in the beds along the side, and then the dates along the bottom. And really, that is showing that, no major change in that over that time period. The short-term support service is a community service, which is a rehabilitation service. It includes both physiotherapists and occupational therapists, as well as support staff. It's about working with people to get back to independence in the community, and getting people either if they've been discharged from hospital back to a level of independence, or if after a period of illness or injury at home. And so you can see again the numbers, and we've got the therapy is the red line, the blue is the sort of care, and the green is a combination of both, because most people have an element of both. So again, that's over the set period, and there is an increase in that in last year, which suggests that more people are having rehabilitation at home. We keep a monitoring of the district nursing caseloads. So we've got, these are the Rothbury district nurses and their caseload. The blue is the appointments that people would come in to see them, and the green, as you'd expect, is what they would be doing out in the community, which is the bulk of the work. And again, that doesn't really show a significant change in their workload. It's also really important to understand the acuity levels of the patients that they're seeing. So this is a bit of a difficult graph to understand, but they have a clinical score from 0 to 4, where they record the acuity level of the patient. So 0 would be the least acute, and 4 would be the most acute. So the 4th is in the orange, and you can see there's only really a slither of orange on top, because actually if people were that sick, you'd expect them to need care in a hospital or more support. So there is less of that, and it just gives an idea across the various teams. So the ones far over is the North teams, the Central Northumberland and West, so it's a comparison of all the nurses in Northumberland and the sort of acuity levels in which they're dealing with. Home care services, so this is information around the support that people get in the community from social care for sort of more long-term care. So again, there is an increase in the amount of people getting home care in the area, which may be associated with the fact that people are getting older and needing more care and support. And this is the number of people from the Rothbury area residing in care homes. Sorry, I just lost my words. It's a different colour on there as it is here. It's just thrown me. So these are the people in care homes. And again, there has been a slight increase in that. Question 2 was around what the impact of the temporary closure has been. And the major impact here has been on travel, and obviously Derry discussed this, and we need to take that into consideration going forward. This information on this slide is really from the last analysis that was done with regard to the travel. So we have got, from the last one we did, there was 203 people within the year from September to August that had actually visited the hospital. So we know that 123 were actually admissions and part of the ward, and then the 80 were visiting the sort of physio or the outpatient services, the health visitors or whatever it was. So we took the larger number, the 203, and of the 203, 145 would have to travel further if they went to Alnwick or Walton. 58 of that number actually had a shorter journey time to travel. So of the 145, we looked, the average of their travel was 3.8 miles to Rothbury. So the closest was 0.4 and the furthest was 15 miles. And so the travelling to the next nearest site would average at 13.8 miles. We got some information from Public Health with regard to the number of people that have access to a car, and that's then on the bottom. So these are people over 65. The percentage in Rothbury is 85% that have access to a car. The Northumberland, compared to Northumberland, is 72%, and if we look at the North East, is 61%. We did update the travel analysis, which we shared with the committee, and we looked at all the surrounding areas within Rothbury, and we looked at the mileage, the time that it would take, and the cost of a taxi, and we looked at the sort of nearest site and the next second, third, and fourth option, which we've shared. We're continuing to look at the public transport and the availability of community providers, and again see this very much as part of our discussions going forward with our engagement. The next question was around the fifth test from NHS England. So in September 2016, the inpatient beds, as we know, was temporarily suspended. The guidance around the fifth test didn't come out until March 2017, when it was announced by Simon Stevens of NHS England. So we couldn't consider the fifth test initially because it wasn't there, but it was very much part of our consideration when we wrote the decision-making report, which was in September 2017, and there is a section about that in that report. The fifth test is really asking, is there enough of a support in the community for the decision that you've made? So we continue to monitor the impact of all the services, some of which I've obviously talked about already, across community services, end of life, primary care, community hospitals, Wansbeck Hospital and the Northumbria, social care and the North East Ambulance. We look at that information to see if there's an impact. We also monitor clinical incidents or any serious untoward incidents which would be reported through primary care around the Rothbury population to make sure that there isn't anything recorded. And we can broaden that out to other clinical systems, as that's part and parcel of what we do. Providing care in people's own homes still remains very much a national priority and is still a big part of what we're trying to do, and is very much part of the new plan that is out. And certainly looking at our new approach in the North, which I have mentioned, around being more proactive, multidisciplinary teams, making sure those plans is still work very much ongoing. The next question around the equality impact assessment, and so yes, we did an equality impact assessment. Again, that was circulated to the committee. The greatest impact was on some older people who access the inpatient beds, and that report did include steps of how we support people in the community, which I've talked about, and how we needed to look to reshape services to maybe benefit a wider population going forward. Again, this is something we probably will reconsider once we've done the engagement. Issues regarding OSC not being consulted around the temporary closure. So initially, the decision was taken around the suspension. It was temporary and an operational decision. This was due to the low occupancy, but also around the need to move the staff to other sites which had a higher occupancy of patients. The Hospital Trust is very much able to make these operational decisions, and as it was a temporary decision, there was no formal requirement to come to OSC. However, the CCG did discuss this with the chair of the time informally to inform them. In December, the CCG did liaise with OSC, as at this time the decision was made to permanently close the beds and move to the consultation period, and the press releases and documentation was shared with OSC after that. As the Secretary of State has noted and highlighted that communication between ourselves, the Trust and OSC could be improved, then we'd be more than happy to maybe look at developing a protocol or something to make sure that we meet everybody's expectations. Finally, the financial justification for the beds. The beds were under a block contract arrangement, and that reduced by 500,000. These costs reflected were direct staff costs of the nurses, the health cares, the domestics, and the GP cover. And that just shows it there. And these are not recurrent while we await the outcome of the report. And the cost in there that is less was for the Macmillan palliative care nurse, which is now in post. So finally, sort of from a next steps point of view, obviously engagement is key, the governance that we need to follow, and the timeline. And this is just a table of that. Clearly, we know that we need to reply back to the Secretary of State at the end of January. We want to commission an independent review of our data, which we'll do in January. The engagement, the exploring, the visits to other services, we would like to take from now until June to conduct that. And so that enables us to come back to the CCG's governing body to be held in public in late summer, Northumbria's Trust in late summer, and to come back to OSC and inform OSC of the decision in late summer. Thank you very much for listening.
Questions, please, if you wouldn't mind just going back. Somebody else?
The questions for everybody, I think.
Okay, all right. Right, panel, this is our opportunity to discuss the answers or ask questions. I'll start the ball rolling. One of the things I think that everybody is very disappointed with is the length of time that this whole process has taken, right from the word go back in December 16, when I would point out, by the way, I was not the chair of this committee, so I was not involved in that. And the time that we took for a response from the Secretary of State was also, I think, lamentable. And I see that we are now talking about further things which are going to take another 5 or 6 months. Can we not speed this up for the residents of Rothbury? Can we not be more explicit in what it is that we intend, or you intend, to offer to them?
Thank you, Chair. I'm Vanessa Bainbridge, the Accountable Officer at the CCG. I think you've already explained the timeline with regard to the period for the Secretary of State. We have taken advice from NHS England, but also looking and taking due regard to the letter from the Secretary of State. Having a proper evaluation, doing the engagement in a meaningful way, as we've heard from Derry and from Katie, will take time. So we feel, and our governing body feel, who we've spoken to this morning, that we need that length of time over the summer, and for them to take all of the options into consideration in late summer, and we hope we'll hold that decision in public.
Okay, so you will, I'll just repeat what you said, you're going to continue negotiations with various parties and try to come to a solution or a proposal that is firm and strong.
So as we pointed out in the presentation, we'd like to work with the campaign group, with Healthwatch, participation groups, the local member, parish councillors, but we want to do that in the small groups, in focus groups, and look at the data. Today, we had to, because of the questions that you asked, give you some indication of some of the data sets that have been refreshed, but they have just been refreshed. They do require being put together and have and what we think is the sensible way forward is have an independent view on that data, and our governing body receive a report, and we'll be happy to share that report as well. So in terms of the next few months, we need the time to do that with the various groups and communities in a meaningful way. We also, this morning with our governing body, felt that it was sensible, given that we're trying to look at the offer and what that means across the country, they were willing to say and talk about funding a post specifically to look at pulling all of that information together, but equally working in the heart of Rothbury and looking at what offers from the community can we look at. So I think doing all that will take time, and that's why we've given that timeline, and NHS England are supportive of that as well.
Can I ask one further comment on that? You talked about in previous answers to questions about a Macmillan nurse being appointed. Is that still going to happen straight away without delay?
They're in post. They're in post from this month.
They're in post now?
Yes.
Thank you. Other questions? Someone? Sorry, are we just doing that?
No, I was, but I... Yeah, I've got a couple of questions or comments maybe. The first one's around the travel, and one of the aspects that's referred to is community transport, which is great, but it's very tenuous in a lot of our communities, and I think in this area it's tenuous. You don't have any control over that, so I suppose what I'm asking is, you're devising services that are dependent on a third party who is dependent on other parties to actually fund them. So is there a fallback plan if community transport isn't available?
Yeah, I think we need to take that all into consideration in terms of the travel analysis that was done before, and the travel analysis that we need to conduct again. But you're absolutely right, Councillor Dunworth, that the community option is a good option, but its longevity is dependent on what the tenure of the contract is. So I think that's incumbent on public sector bodies like ourselves and the council to have conversations about planning together and going forward, and how we can look at various options, including what the CCG fund, which is patient transport, and how that looks in the future as well. So I think there is the patient transport. There's obviously the wards themselves elsewhere. When patients come to wards in Wansbeck, the staff will have conversations and look at mitigation and travel plans as well. So all of that we'll need to take into consideration, and we're willing to do so and have those discussions.
Yeah, can I just come back on that one? That's great, and I'm interested about the idea of patients' travel plans, although here we're talking actually about residents visiting, families visiting. What I'm concerned about is plans being put in place that pass a funding responsibility to other organisations, be they the community voluntary sector or indeed this council, who are strapped for money as well, when we're looking at a plan that makes a considerable saving to the CCG in terms of providing health care in Rothbury, and that it'll end up costing other people more to enable that plan to carry on. I'm not sure you can answer that, but I think it's a point that I would like taking back to the commissioners.
But we will take that back. We will take that back.
My other question was just really because I don't understand what it means, if it means anything. I'm not being flippant there, but the table that was around residential care, so the number of people residing, well, both the home care number of clients and the number of people residing in care for this financial year has had a reasonably significant, if that's such a thing, increase in this area. Is that as a direct result of the closures, or is there something else accounts for that?
I think, just to be clear about the data we've presented, these are data sets that were used before, so I don't think we should draw particularly, we can draw several hypotheses, but I'd rather do that in the discussions going forward. I think, and if the adult social care representative here today wishes to come in on that, I'd be happy for him to do that. But there is, again, can I just point out, it is still small numbers if you look up the left axis of the graph, and there has been, what we're stating is there's been an increase. A hypothesis could be there's a general increase across Northumberland, and we can bench that mark with the council data, or there is a hypothesis that some of those people who may well have gone into Rothbury may well have made some of those numbers. But again, we'd need to do further work. But
So the first graph refers to Northumberland as a whole. Does it, the one about number of clients with home care, or is that Rothbury area?
That's the Rothbury.
Right,
so home care is Rothbury, and so is care homes.
Right. I suppose then my, just a health warning, for lack of another term, is there has to be a purpose for presenting data. So just to present data that then says, but actually it might have no relevance to what you're discussing anyway. Can I just make a point? I'm not making points for an audience. I am genuinely trying to make sense of this for those of us who are asked to make a decision on it. I am always suspicious of data, I'm afraid. So things need to have a real purpose to be put before me, or else don't bother, I suppose I'm saying.
Can I just come back on that? It is a relevant data set that was used before, and I do think it has a relevance. But what I'm caveating is we would like to spend time in the sense of where that data set fits with all of the others, just as we've said before, but it is a relevant data set.
I suppose my final point is around staffing, and I suppose that goes back to the original decision, I suppose. Is this still working?
Yes.
Yeah. Is that the part of that was about a staffing shortage for hospital care. Is that still an issue for us?
It is still an issue across the trust and across the country in relation to recruitment, both medical, nursing and allied health professional staff. So again, something that we would need to consider as we move forward and think about the integrated care for this community. We will need to think very closely and very carefully about what the pertinent workforce would need to be for that. But we couldn't sit and say there are no challenges in terms of recruitment into that workforce. That is not just for this area, that is a regional and a national problem.
And I think home care work, again, I said community transport was tenuous. I think home care is really tenuous again in this area. So we need to be sure when we're planning for services that we're not making assumptions that things will happen unless they're funded and recruited too.
And staffed. And I think Rachel said earlier, in the design of the future of services, there will need to be something really detailed about what the workforce plan looks like to maximise the potential.
Okay, thank you.
Anyone else got a question? Robbie first, I think.
Thank you. I was just wanting to just pick up on some of the points that were raised to do with travel, actually, because obviously ongoing changes are happening, and the Walton unit is now at Ashington rather than Morpeth. and all of the data sets that we've been looking at in the report that's been produced is relating, it's the historic report that is relating to the travel distances to Morpeth and Alnwick as opposed to Alnwick and now Ashington. So how is that going to be considered now going forward? And well, do you want to just touch on that first? No.
Yeah, so I think obviously when the Walton transfer came to the overview and scrutiny, the travel plans had been taken into consideration in terms of the journey time by car and the time by car, but clearly it is very difficult to get from Rothbury to Ashington on a bus or public transport. And there was a recognition of that, and a recognition if that was difficult around picking up travel plans on a individual basis in terms of the Walton transfer. That absolutely we will be updating the travel analysis to reflect that. But as it stands, a journey from Rothbury to Ashington would add an additional sort of 10 minutes onto a journey. In terms by car, but obviously by bus that would be more difficult, and therefore we would need to do further work as we've already discussed.
So bearing that in mind, that it is further to travel to Ashington, particularly if you're at the far end of Coquetdale, are those changes likely to have an impact on what your revised decision is going to be going forward?
Obviously, the CCG, after we've done all of the engagement, have to take into account the engagement feedback, the travel analysis, the equality impact assessment, the staffing issues, the environment, and all of that needs to be taken into the round. And then a decision will be taken based on that, which will include looking at the Community Health and Wellbeing Centre, but including the beds as well. So the Secretary of State's letter was very clear that we need to look at the data in the intervening period, we need to do meaningful consultation, we need to gather that information and evaluate that over a period of time, and then take that decision back to the governing body for them to make that final decision, and they will have to balance all of those issues.
And it's not just about travel, because one of the things that the Secretary of State does pick up on is the experience that someone that's using the hospital is going through, but also the experiences of families and carers. How are you actually going to get to the heart of what those issues are? Because in the presentation we've heard there, focus groups are going to be created, but yet it was stated in the presentation that it is not yet known how not yet known exactly how those groups will operate or what strategy those groups will have.
So I think that Healthwatch, Derry, gave a very good presentation, and I felt that it was a journey. So Healthwatchers have been involved from the onset of this, as have the campaign group, but Healthwatch in particular gave feedback today to talk about how they'd gathered the views of the residents and families and feedback from carers, and that will be ongoing as part of that process. So we'll gather that information from Healthwatch and from the local member, from parish councillors and from the campaign group, and take that on board. But we have to, that will be balanced by other information as well. So that won't be the only information, and I know you know that, but I just need to be clear that we have to balance all of the information, and the governing body will take a decision based on the balance of that information.
Okay. I've got just a few more questions, actually, if that's all right. Just to do with financials, one of the things that is picked up by the Secretary of State in his correspondence by the report that attached to his letter was just referring to obviously the financial aspect has a huge factor in the decision-making process as well as alongside others, but he's specifically stating that in 2017 to 18 the CCG were expecting a deficit, but Northumbria Healthcare Trust were expecting to be in a surplus, which was pretty much about the same. So can you just explain to me how the CCG are operating in a deficit, the Healthcare Trust is operating in a surplus, and how those issues get taken into account when weighing up a decision which is then partially reliant on saving money?
Okay, they're under two. I mean, this would be a much longer session to explain the financial situation of a CCG or a trust. So the trusts are regulated by something called NHS Improvement, and they have to meet certain requirements. CCGs are regulated by NHS England. We have a deficit in the CCG, and the trust posts a surplus. Now, you may think adding those together creates a note. That's not how the money flows within the NHS. And I think, to be fair and do this justice, it probably requires a further written response, and maybe the trust would like to comment.
I think from a trust perspective, we would say that not all of our income that generates that surplus comes from within Northumberland. So we serve a much wider population. So it is probably oversimplified to be able to equate those two figures to come back to a zero balancing position, because obviously we have different funding flows from a wide variety of commissioners.
I think, Councillor Moore, just to also add to your patient experience question that you asked earlier, just to assure you that the Trust has a really well-established patient experience programme. We test every single day patients who have an experience with us, and that evidence is published on our website in real time. So we have an evidence base behind any experience that our patients have.
Finish? One more? Go on, keep going.
Yeah, sorry, this is just to do with some of the graphs that were presented, because I'm slightly confused to do with some of them. So it's just the graph, which is this one here, which refers to short-term support service, number of referrals. It seems to me as if the number of those patients that are needing care is actually, which is the blue, is actually increasing by about 35 referrals from 2016. Going forward, what's the impact? How does that relate to Rothbury if the number of referrals are increasing by approximately that number? But there's definitely an increase over that period of time.
And you would expect an increase over the population of Northumberland and of Rothbury, given the demographics. So the short-term support service is an integrated service that has what was sort of domiciliary care services linked with therapy services. So many people may require some therapy only, and then that they get rehabilitated, and then they don't require anything else. Some of the patients will require just some more personal care, and because of the demographics, it has gone up in number. And again, I would ask maybe some of our adult social care colleagues to potentially comment, or when we do the exercise on looking at the data more fully, we'll include that.
And then just final question to just do the graphs, which is this one here, average care plan per whole time equivalent per month, where it's got the different levels on for average care plan. And you referred in your presentation to level 4 being the worst level. So my question is, just looking at the graphs, it seems as if, looking at the Rothbury area, there are more patients at level 3 and 4 than there are, for example, in Alnwick. And I just want, or even Amble, or even Berwick. So I'm just unsure as to how that is slotting in, or will be taken into account in terms of the decisions that are made.
Yes, I think as with all of the charts, as you've quite rightly said, there is a surface level of data that we are presenting here, which can be interpreted multiple ways. The work programme will really need to get under that to determine what is it actually telling us about the growth in the activity versus what might it be telling us, for example, in the growth in service. So if you went back to the short-term support services, more people are accessing that service because that service has expanded. That'll be part of it, and part of it may be linked to demographic. But I suppose the devil's in the detail with any sort of data set, isn't it? So all of the aspects linked to Rothbury and in comparison to our population in its entirety, I think, as Vanessa has said, will be further and analysed in more detail to allow us to form an opinion, which would then present back in more detail.
Okay, thank you, Chair.
Where's the next?
Yes, thank you. I've got a raft of questions and I'm going to try and précis them as best as I can. But the first thing I'd like to comment on, I've got 3 slides that I'm trying to refer to as well. We've got a group of people here who I'm trying to weigh up the evidence that's been put forward today and in the past. And I perceive that we have a group of people here who perhaps are existing in a black hole because they don't exactly know what's going to happen, and they are obviously concerned. You've got a slide on your current community offer. It looks very good. I'm not criticising it, but we have heard that some suggestion that maybe it was there before or maybe it wasn't. But regardless of that, we have to take on board that that is a good current community package. I looked to your engagement proposal, which of course is really the crux of this, is that you are going to have to engage and you're going to have to find out from the people, the patients that you serve, what is the best outcome for them. And I do take on board your comment about refreshing of the data. Data is only as good as the date perhaps that it was published. So then I ask myself, and I come back to the patient experience, it saddens me, and I feel as if it's like deja vu that I said this 2 years ago, that no progress has been made on the first floor. I do understand, however, that it's like the chicken and the egg. You've had to try and work out what was best. But I think you have largely ignored and not made good use of the very people that could have helped you. So coming back to the patient experience, what I would like to know, and I'm sure hopefully it might help the people here today, is has there been any immediate feedback on the recent changes to date of the changes that have already happened? Have the patients been asked? And I hear, Claire, you're going to say to me, yes, it's published on the website. But I think people need to hear what people's experiences are so that they can then help you with the future and also make judgments as to whether the current changes and the future changes are actually going to be of benefit. So I appreciate you've got it on your website. Can you please tell me what people are saying about the current changes?
So our patient experience programme goes into detail based on a ward base on how satisfied they are with their services, and it may be worth at another ask going through all of the detail there, because there is a raft of information and a wealth of comments that I think the Overview and Scrutiny Committee should see in the round rather than just individually. Now, I haven't done the cut relating to people who would have been a Rothbury resident, but I can ask the Patient Experience Director to have a look at this for you.
That would be very helpful, and I'm not going to preempt. It's obviously the chairman will make the decision, but I know I would like to, it's stated in the papers, to come back perhaps in 6 months, and I think these are the sort of questions that I certainly would be asking when you come back with an update. Thank you.
You pass that on. While you're passing that on, can I ask a question? I did ask this question the other day, and I don't think you've actually addressed it. In the previous documents, there was a mention that there were beds available at the RAF centre in Rothbury. I noted at the time that the audience poo-pooed that. I asked the question last week, is it the case that beds are available at the RAF? I haven't seen a response.
I think I answered at the time, but I will get you a response and happy to share that. I think it was on an individual case basis where there was a respite need. So I think there has been a small number of individuals where I believe that actually social services negotiated a respite. So no, They're not used every day. They're not used for the GP to refer into, and no, the hospital can't refer into them. But it was specifically picked up a discussion with Rafa around on an individual case basis for respite. So I think that probably does answer your question.
It does. Yeah. Following on from that, and it's difficult to ask the question almost because we're not here to look at the bed situation, but it's part of the whole thing. I noticed in the meeting we had the other day that we said in 3.5 years, some 42 months, we'd had 62 patients who'd had palliative care at Rothbury. It's a very small number. You can play around with it and say it's 1.5 a month. I don't know what that means. I don't know how long people say. But obviously it's important to those people, those individuals, about what happens to them. And I think what you told us then, and I'm just asking the question so you repeat it, was all of those people were taken care of in a proper manner. They were in proper palliative care, and you didn't have any clinical complaints. Can you just please verify that that is the case?
I can't remember the actual data set you're referring to, Chair, but your question is around what palliative care offer and what is the offer. And I maybe ask Helen to come in as well. So the Trust have a very good palliative care service. So, and what you're probably more referring to is end of life, which is in the last few days of somebody's life, that a care package, including nursing care, sometimes social care, equipment, will allow somebody to stay in their home. And that does happen across the Northumberland and within the Rothbury area. So yes, we have helped people to die comfortably within their own home and receive feedback on that. I don't know whether there's anything particularly to add on that from the Trust, and I'll hand over in a second. But there are people who, for whatever medical reason, may well go into our tertiary services like Newcastle, and because of their particular medical condition can only be served there, and also because of their medical condition may have to die there.
Yeah, I understand that.
And there may be people, that, again, who have chosen near the end of life to then go into particularly a nursing home or a care home for whatever reason. Or we will have had some of our residents who have died in ANIC in that period as well. I don't know whether, Helen, you wish to add anything.
And I'll just say that it's a really important point around end of life care, and the vital thing that we would always endeavour to do as a system is to ensure that there is a good and active engagement with the patient and their carers and family to, as far as possible, respect the wishes of that person as to where they would like to see their last few days out. That can be challenging in terms of what service provision there is available to us, but we will always endeavour to work with those individuals to make sure that we can meet their needs as far as we can against their wishes and desires.
Thank you. Councillor Cessford, I think it was you next. Oh,
yes. Hello. Thank you. Yes, thank you. That was really my question, actually, about the palliative care. And what support in your quality impact assessment, where you said supporting people at home, what support are you giving? You know, I know that you have a palliative care nurse now, a newly appointed nurse practitioner for fertility, but with district nurses, I don't know, how many do you have in Rothbury?
I don't know the number
you don't know the
off
number.
the top of my head, but we can certainly provide you with
Yes,
that information on the numbers.
All right.
Sorry, can I just... I think your question is about what additionality, isn't it? So for closing the bed, so there is and always has been a district nursing service and a palliative care service already there. So just to be clear to the panel, the specialist nurse Macmillan is additionality to all of the care that goes on around palliative care. And the reason we put that post in, and we felt that we needed to do it, even though the decision hasn't been made, is not because at this moment we're feeling that the nurses' caseload, we're unable to meet that caseload. We felt that actually we wanted to put that in and help review the situation as well. So that's why but it's an additional post. It isn't just that post that offers that care.
Right, as well as more people have been going into residing in care homes as well from since the hospital has been closed for beds.
And again, a hypothesis could be that would be in a general trend anyway, or another hypothesis is yes, their needs are being met there.
Okay, thank you, and I look forward to seeing the written report on the money, the surplus as well, and the deficit, because that was a bit confusing in the Secretary of State letter as well.
Yeah, all that we will be reporting on is giving you an explanation of the surplus and of the deficit, a written note of the explanation. It won't be how the 500 is picked up in that, because that is not appropriate.
Okay, thank you.
Okay, next year.
Yeah, thanks. If I can just make a couple of points, Chair, if that's all right. I'm going back to some of the answers that were from the questions that were submitted. Basically, if we talk about the development of ideas at Health and Wellbeing Centre, it's more or less saying that they weren't able, well, I don't actually know what's going into this Health and Wellbeing Centre. I mean, when are you going to formulate, if that is the option that you come up with, when is it going to be formulated, all the things that they're going to be offering?
So, this is what we've been presenting today to say we have the Rothbury Hospital currently, and it had some services already and a good community offer. The GP did transfer the practice into the hospital. That was planned before the consultation, and it's not because of the consultation. But as a consequence of that, they are able to bring together a number of the services, and we can take that opportunity because they've moved in there. In addition, we've added a Macmillan nurse in there. So from an NHS family provision, we stated in the presentation that there is already an increased and an improved offer. But again, there was some, in the second slide, which was what we can do in the NHS family, which was rheumatology clinics, virtual clinics. They are the things that we're exploring with the Trust at the moment to say, how can we put them in place? And they will form part of the NHS improved offer. The other area is about what else can a Health and Wellbeing Centre offer. And if we look at good practice across the country, you can't just say it just doesn't happen overnight. These things evolve, and they've taken a year or a couple of years to evolve in a community because it's meant to be community-led. So rather than top-down, it should be community-led. Hence why we want to pull in on the community coordination project.
Okay. If I was to come back to something else, which is the initial decision was to temporarily close the ward. And I'm sure, as happens a lot of time when things are said to be temporary, that people always suspect that they're not actually temporary. And so there was no formal requirement to inform the Overview and Scrutiny Committee to see if there was a significant variation, which of course would require a formal consultation. I mean, that answer that we've got down here, maybe it's just written wrongly, or badly should I say, but it doesn't seem to instill me with confidence that there's any cohesion there. I mean, you either sort of, is it a way of avoiding a formal consultation is what I'm saying at that particular time, by saying it's a temporary closure. I mean, if there's going to be there's going to be a closure, surely a formal consultations at the outset would have been the best thing to do anyway.
Stephen Young, Head of Corporate Affairs at the CCG. Just to comment on that, that as Rachel said, there is no requirement to formally consult with us on temporary closures. And Claire or Helen may well come back in on this, because this is operational decisions that are taken by trusts across the country on a daily basis. The question is, how temporary is temporary? Yeah. And that's a bit of a moving feast in legal terms. But when we're looking at things like the Walton unit, both parties have agreed that actually that temporary relocation from Walton into Ashington is time expired by 3 months. Then there'll be a review, then there'll be a decision taken one way or the other. And if that decision is taken to permanently close the unit, then we will consult with Overview and Scrutiny. And if it is a permanent closure, and Overview and Scrutiny consider that to be a significant variation in current provision of service, then we will have to consult.
Yeah, I think it's just picking up on Stephen's earlier point. The operational team at the time made the decision to temporarily suspend the services for the reasons that I think the panel are familiar with. And there is no requirement. What we are aware is there were a few conversations with the chair at the time, obviously not the current chair, with regards to the temporary arrangements. And then it's gone into a formal process after that. And I think it's the difference between temporary for operational reasons and then it turning into a longer term arrangement.
Okay. And finally, I want to pick up something that you said earlier on, which was, you know, and it's to do with what was at the end of the Secretary of State's, Matt Hancock's letter, which was consideration of the option of reopening the inpatient ward must form part of the work, and that's what you said was actually going to happen. So, I mean, I think on behalf of the people who have come today, they want to know that that is actually a proper statement and not just you know, I mean, you're going to listen to everything that's been said, and it is still nothing's decided. All options are still open, and that could be one of the options that are on the table.
Absolutely. We were at our governing body this morning and we went through this presentation with them, and they were very clear about the Secretary of State letter and their commitment to options being on the table, including the bed base. And they are assured that over the next few months we will gather the data, we'll gather information, we'll engage, and we will use all of that information, and they then need to take that into consideration and be briefed, and then we'll have that decision in public. But yes, the opening of the beds is a consideration. Yeah.
Thank you.
Right back up here.
Thanks for letting me come in again. I wanted to go back, I suppose it's just been touched on right at the end there a bit, and that's about where we go from here, because people have already pointed out there've been a lot of delays, and whilst there's been delays, and some of those I think are understandable in not wanting to preempt a decision by taking actions, but it does mean that what's been identified as the health needs in that area are not being fully met if we don't move you don't move forward with the plans. So I suppose my point relates to the last paragraph on the letter from the IRP on page 11. And, you know, the old saying that if you keep doing what you've always done, you'll always get what you've always got. And I think there's something in there about how we do consultation and how we do engagement. And you know, they themselves noted there was a fractious tone to some of the evidence and correspondence submitted. I think that is perfectly understandable when you're dealing with an issue of this significance, of this importance to a community. And I suppose from you, I would like a bit more detail and some reassurance that the consultation going forward and the engagement is going to be different from that's happened in the past.
I think first and foremost, Councillor Dungworth, and I probably need to say this, we are not reconsulting.
No,
so,
I know you're not.
But we used a number of methods last time, which Rachel outlined, which was it was outlined. I think that we have learned from that, and I don't think that necessarily repeating that would give us a best way forward, nor do I think it would be satisfactory for the local member, for the campaign group, or for Healthwatch. What we're hearing, and actually Derry said this before we actually did our presentation, the request is to do smaller groups, focused effort on the subject matter and work through that. So we would like, and we're reaching out to look at doing engagement in that way. And now we will have to work. It will be difficult because we're currently, it is uncomfortable, but we feel, and we have reached out to go, that we would like to move forward in a focus group way with Healthwatch, with members, and with the campaign group, and with professionals who are working in that area, who it's important to do so. I don't know whether Claire would like to add anything in terms of that, but we want to do that differently, and we've learned from before and taken that forward and looking at starting with the data. What we did before was we actually presented the data cold to large groups in Rothbury, and actually it was really difficult. And I think that when you look at any co-design or any work like this, it is far better to try and start. It's a difficult conversation, it's a tricky conversation, but to start to try and look at all of the information together and then move forward together. And that's the commitment from the governing body this morning, where we were clearly instructed to do that.
Yeah, the Trust will work really closely with the Clinical Commissioning Group and all of the partners to help to support this work going forward, and very much the approach that we've had since the temporary closure took place.
Can I just add one other thing, because I've heard remarks of, well, just get on with it. As I think various people have said from a CCG perspective, it was always a CCG's intention, post-consultation, to engage with the local community in a meaningful way about the future of the Health and Wellbeing Centre. Unfortunately, we've been precluded from doing so because we were referred to Secretary of State, and as Councillor Dunworth said, we're therefore precluded for taking forward that action. We don't want to preempt any decision that's coming from the IRP. We will now seek to take that work forward as quickly and as safely as we can do.
Can I just say I wasn't so I wasn't meaning to reopen the consultation. I was talking about how you engage with people going forward, which you've touched on, and I think the point that was raised by Healthwatch about listening and hearing. And consultations, I know because I've been involved in lots of them, are very, very difficult, and there will always be people who are not happy with the result of them. But what is important is to feel that you are listened to, and that somewhere in all the myriads of documents you can say, well, that came from a contribution I made, or at least they've looked at that, even if they haven't done it, and that is really, really important.
So can I just say the senior team and the governing body and the chair of the governing body were very, very committed to that.
Okay, any further questions? Robbie, would you like to say something?
Yeah, it was just obviously things have been changing at a national level, I suppose, as this whole process has been going on, and we've now had the long-term NHS plan has been issued. So I suppose what I'm getting at is we would want to, do you take that into account? And the reason I'm picking on that is because in the opening paragraphs of that long-term financial plan, it deals with supporting people to age well. And we know that Rothbury has an ageing population. And what we would want to see is reassurance that you're meeting that, because it clearly states that as part of that, giving more people more say about the care that they receive and where they receive it. So I'm pleased to hear that you're wanting to open up more of a dialogue with the local community, but we need to have that reassurance that that's going to absolutely happen going forward. And then on that point, on your final slide, you set out a time frame. And I think you were proposing that you came back to this committee in end of summer.
Sorry. So we set out the governance for the CCG. So we set out the engagement, and we'd be taking a decision to our governing body, Health and Public, in late summer, and then we would write to you formally, literally that day. And then it's entirely up to the Scrutiny Committee.
Because what I would like to propose is actually that we get an update much earlier than that as a committee, so that then we can actually then properly feed into that process, rather than just getting an update on your final decision at the end?
No, that's not what we were suggesting. What I was setting out was the governance for the CCG, and that we would inform you of that decision. But I fully expected today there would be a discussion about how you, in the next steps, because this is just a progress update, that's my understanding, to the Secretary of State. So we fully expected you'd be discussing and then talking about next steps.
Okay.
Right, well, I think...
Sorry, Chair. I think...
Sorry? Yeah.
Just to make point to the NHS long-term plan, I'm pretty sure it's on the work programme for the either Health and Wellbeing Board or the Overview and Scrutiny Committee to actually go through the findings of the long-term plan, Councillor Moore. But also, it's a obviously a long document. I think there's about 140, 150 pages worth of comment in there. But there's also a really large feature about community services and a move out of hospital into the community in there too. So it's really, really important that it's all understood from within that document.
All right, thank you. Need to come to an end, I think. Remember that we're here to consider the findings of the independent reconfiguration panel as accepted by the Secretary of State, and that we were asked to make a balanced response for the end of the month. We've seen and heard lots of things today. CCG has given us further information about the issues raised by the IRP. There have been mistakes, I believe, in the way the consultation was carried out, and I hope lessons have been learned from that. I'm sure the CCG will need to provide further explanations to the NSS and the Secretary of State about what went wrong. This committee has made its views fairly clear to the CCG, I believe. At this point, I suggest we leave the NHS to learn the lessons from this experience. The final issue is the Secretary of State's request for an update by the end of this month. I propose a couple of things. First of all, I agree and I formally request that we will have an update meeting, which you have already agreed to. We want to keep this committee informed as to what you're doing. But I'm going to ask our officers of this council to come up with the details of this meeting, and to prepare and draft an agreed update based on what we have said. I will then circulate this to members of the committee for them to approve. That's an accurate record of what took place today. I will then sign this and send this off to the Secretary of State, at which time I will also arrange for the letters to be sent to the interested parties, such as the local member and the Save Rothbury campaign. I look forward to hearing much more from this in the future about how we can make best use of this wonderful modern building that we've got in Rothbury, and that we supply the community of Rothbury with a opportunity to create something really special. I mean, over the last 2 years or so, we've seen a real feeling from the community about community spirit and about its feelings, and I think we need to answer them fully and properly and communicate with them in a good way. And I think with that, I will call the meeting to an end. There's some other business. Yes, what is it? Sorry? What? Work program. We have it. Yes. This is a normal thing that we do at each meeting is the work program. I'll pass that over to Mike to take us through it. Mike, please.
Just to confirm for the committee, the last meeting, we included the work programme in this meeting because there was a request at the last meeting about some possible theme scrutiny, end-of-life care, and I was asked to report back to this meeting. So discussed with the chair, and I've circulated a previous report that was considered by the Care and Wellbeing Scrutiny Committee 7 years ago. So we're going to look into perhaps whether there's an update on some of the recommendations from that, and then feedback to the committee. So that's just the one item under the work programme. just to add as well that of the work programme, members previously considered an item about hospital in Berwick, and I've received some information about a feedback engagement report which is going to be just circulated to members of the committee for information now.
Thank you, Mike. I have no urgent business, so I can actually close the meeting completely. Thank you very much.